To the healthcare workers who stood on the front lines with courage and compassion. To the activists who demanded dignity, research, and justice. To those living with HIV/AIDS whose strength continues to inspire hope. And to the countless lives lost in this historic battle. We praise your resilience, your humanity, and your enduring impact. Your voices, your struggles, and your legacy remain at the heart of this story and continue to guide us toward a more compassionate and informed future. You are remembered, you are honored, and your light continues to lead us forward. The AIDS epidemic stands as one of the most profound and transformative public health crises in modern history. Its story is one of tragedy, resilience, and ultimately hope. A narrative that began in fear and misunderstanding and evolved into a global movement for compassion, scientific advancement, and social justice. For 2 solid years, I worked at a healthcare agency that was completely dedicated to caring for HIV/AIDS patients. This experience gave me a first-hand understanding of the epidemic's impact, not only on the lives of those affected, but also on the broader community. It was a time marked by both heartbreak and inspiration as I witnessed the courage of patients and the unwavering dedication of caregivers. My time there deeply personalized the ongoing story of AIDS for me, reinforcing the importance of empathy, advocacy, and continued progress in the fight against this disease. The first recognized cases of what would become known as AIDS, acquired immunodeficiency syndrome, emerged in the United States in 1981. The Centers for Disease Control and Prevention, the CDC, reported a rare form of pneumonia in young gay men in California, making the first public alert to a mysterious and deadly disease. In those early days, the illness was shrouded in confusion and stigma, often referred to as gay-related immune deficiency or gay plague, reflecting both the limited understanding of the disease and the prejudices of the era. Only later did scientists identify the underlying cause, the human immunodeficiency virus, HIV, which attacks the immune system and leaves the body vulnerable to opportunistic infections. AIDS spread rapidly, crossing borders and affecting millions worldwide. By the early 2000s, over 36 million people were living with HIV, and some 20 million had already died. The epidemic struck hardest among society's most marginalized: gay men, sex workers, hemophiliacs, people struggling with drug dependency, and the poor, which intensified existing inequalities and exposed the deep fractures in healthcare and social support systems. The early years were marked by fear, denial, and discrimination. Governments were slow to respond, and many patients faced not only a terrifying illness, but also social ostracism and even violence. Yet amid the suffering, communities organized. Activists, many of whom were directly affected, demanded research, treatment, and dignity for those living with HIV/AIDS. Their courage and advocacy led to historic changes in public health policy, drug approval processes, and the visibility of LGBTQ rights. The AIDS crisis galvanized the scientific community. Researchers raced to identify the virus, understand its transmission, and develop treatments. The introduction of antiretroviral therapy in the mid 1990s transformed HIV from a death sentence into a manageable chronic condition for many, allowing people to live longer, healthier lives. Massive public education campaigns helped dispel myths about transmission and promoted safer sex, saving countless lives. AIDS changed how the world thinks about public health. It underscored the importance of global cooperation, the need for stigma-free healthcare, and the power of affected communities to drive change. The epidemic exposed the vulnerabilities of the world's poorest and most marginalized, highlighting the intersection of disease with poverty, discrimination, and lack of access to care. The AIDS epidemic is not just a story of loss. It is also a testament to human resilience and solidarity. It forced societies to confront prejudice and to recognize the humanity of those once cast aside. It inspired a generation of activists, scientists, and caregivers who refuse to give in to despair. Today, while HIV/AIDS remains a global challenge, the world is armed with knowledge, treatments, and a renewed commitment to ending the epidemic. The memory of those lost and the lessons learned continue to shape a more compassionate and just world for all of us. Today, we'll be discussing a topic that's very close to my heart: home care for patients with HIV/AIDS. Managing this condition at home can be challenging, but with the right approach, caregivers can provide supportive, compassionate care that truly enhances the quality of life for the patient. In part one of this two-part series, we'll cover the basics of HIV/AIDS, the progression of the disease, and how to create a safe and supportive care environment at home. Let's begin. First, let's define what HIV and AIDS are. HIV, or human immunodeficiency virus, is a virus that attacks the immune system, specifically the CD4 cells, which help the body fight off infections. Without proper treatment, HIV can weaken the immune system, leading to AIDS, or acquired immunodeficiency syndrome, which is the most severe phase of the infection. As a caregiver, it's important to understand that although there's no cure for HIV, treatments have improved significantly, and many people live long, healthy lives with proper care. HIV progresses in 3 stages: acute HIV infection, chronic HIV, and AIDS. Patients in different stages will require varying levels of care. In the acute stage, flu-like symptoms might be present, but as the disease progresses into the chronic stage, symptoms may be more subtle. AIDS is the most advanced stage and can result in opportunistic infections, cancers, and other life-threatening complications. Your role as a caregiver involves monitoring for these symptoms and helping manage them. Symptoms like fever, fatigue, night sweats, diarrhea, and weight loss are common and should be reported to the healthcare provider. Additionally, infections like pneumonia and tuberculosis are more likely in patients with weakened immune systems, so maintaining vigilance is key to providing proper care. One of the most important aspects of home care for patients with HIV/AIDS is ensuring a safe and hygienic environment to minimize the risk of infections. This starts with proper hand hygiene. Always wash your hands before and after providing any care, whether it's changing dressings or helping the patient with personal hygiene. Gloves should be worn when handling bodily fluids or contaminated materials, and all linens, towels, and clothes should be washed separately at high temperatures. Keeping the home clean is important, especially if the patient is in the later stages of the disease where their immune system is severely compromised. In terms of personal care, pay close attention to oral hygiene, skin care, and wound management. Oral infections and skin rashes are common in patients with HIV, so gentle, consistent care can help prevent these issues. Another significant component of caring for someone with HIV/AIDS is ensuring proper nutrition and hydration. A well-balanced diet helps maintain strength and supports the immune system. Malnutrition is common among patients with HIV, so meal planning should focus on nutrient-rich foods like fruits, vegetables, lean proteins, and whole grains. Patients may experience a loss of appetite or difficulty eating due to symptoms like nausea or mouth sores. If this happens, try offering smaller, frequent meals throughout the day. Hydration is equally important, especially if the patient is experiencing diarrhea or vomiting. Encourage them to drink water regularly, and if they're struggling with fluid intake, consider electrolyte solutions to maintain balance. Receiving an HIV/AIDS diagnosis can be life-changing, both physically and emotionally. Many patients struggle with fear, anxiety, and even depression after diagnosis. These feelings can stem from the stigma still associated with the condition, the uncertainty about their health, and the fear of being isolated from friends or family. Patients may also experience feelings of guilt, shame, or low self-esteem. Some may question their sense of identity or feel they are no longer in control of their lives. As a caregiver, it's important to recognize that these emotional struggles are just as real and impactful as the physical symptoms of the disease. Creating a non-judgmental space where the patient feels safe to express their feelings is a key aspect of emotional support. You don't need to have all the answers, but being a compassionate listener can provide immense relief. As a caregiver, you play a pivotal role in the emotional well-being of the person in your care. Your presence alone can offer stability and comfort, but it's also important to go beyond providing physical care. Emotional support comes in many forms, including active listening. One of the most powerful ways to provide support is by simply listening. Allow the patient to talk about their fears, concerns, and emotions without feeling pressured to fix things. Just being there can make them feel less alone. Encouraging open communication. Patients often feel hesitant to share their feelings, either out of fear of being a burden or because they believe others may not understand. Encourage open dialogue, letting them know that their emotions are valid and that they have a right to express them. Offering reassurance and comfort. Remind the patient that living with HIV/AIDS is no longer the death sentence it once was. Treatments have improved dramatically, and many people with HIV/AIDS live long and healthy lives. Offer them hope and reassurance, emphasizing the positive steps they're taking to maintain their health, respecting their privacy and autonomy. It's also important to respect the patient's privacy. Some patients may want to keep their diagnosis confidential or choose when and how to share it with others. Supporting their choices and respecting their autonomy is key to maintaining trust. One of the most challenging aspects of living with HIV/AIDS is the stigma that can still accompany the diagnosis. Many patients face discrimination or judgment, which can lead to feelings of isolation and loneliness. They may avoid socializing or cut ties with loved ones, fearing rejection or misunderstanding. To help patients cope with this, encourage them to build a support network. This could include family members, friends, or even online or in-person support groups for individuals living with HIV and AIDS. These connections remind patients that they are not alone, and having others who understand their experience can be a tremendous source of comfort. Additionally, educating family and friends about HIV/AIDS can reduce misunderstandings and fear. Offering to facilitate conversations about the condition, if the patient is comfortable, can help strengthen relationships and reduce stigma within the home environment. Living with a chronic condition like HIV/AIDS can increase the risk of mental health challenges such as anxiety and depression. Patients may worry about their health, their future, and the potential for rejection from others. The burden of managing daily treatments can also contribute to stress and emotional exhaustion. As a caregiver, you can help by monitoring for signs of depression or anxiety. Watch for changes in mood, behavior, or energy levels. If the patient appears withdrawn, has trouble sleeping, or shows a loss of interest in activities they once enjoyed, these may be signs of depression or anxiety. Encouraging them to speak with a mental health professional can be an important step in their care. Encouraging professional mental health support. For many patients, talking to a therapist or counselor can provide a safe space to work through their feelings. Many may benefit from cognitive behavioral therapy, which helps patients identify negative thought patterns and develop healthier coping mechanisms. Practicing relaxation techniques. Introducing relaxation techniques such as deep breathing exercises, meditation, or gentle yoga can help manage stress and anxiety. These practices can also create moments of calm in an otherwise overwhelming day, promoting routine and stability. Establishing a daily routine can help the patient feel more in control of their life. Predictability in their day-to-day activities, whether it's taking medications at the same time, having a regular meal, or scheduling time for rest, can reduce feelings of anxiety and give them a sense of normalcy. In the later stages of HIV/AIDS, the emotional and mental needs of the patient may become more complex. As their health deteriorates, they may experience feelings of fear, grief, and loss. Some may feel hopeless, while others may struggle with the idea of being a burden on their loved ones. During this time, your role as a caregiver is to provide both practical care and emotional comfort. This could involve simply sitting with the patient, offering a reassuring hand, or engaging in conversations that allow them to express their fears and concerns. Palliative care teams may also be involved to provide additional emotional and psychological support. Encourage patients to discuss their wishes for end-of-life care if they are ready. These conversations can help them feel more empowered and give them a sense of control over their future. Providing mental and emotional support for HIV/AIDS patients in a home care setting is a delicate, ongoing process. It requires patience, compassion, and an understanding that the patient's emotional needs are just as important as their physical health. As caregivers, we have the opportunity to make a lasting difference in their lives by offering empathy, kindness, and unwavering support. Remember, you are making a profound impact on the lives of those you care for. This wraps up part one of our two-part series, HIV/AIDS Home Care, Balancing Physical, Emotional, and Mental Health. In this episode, we've covered the basics of HIV, symptom management, infection control, and the importance of nutrition and emotional support. In part two, we'll go deeper into treatment adherence, dealing with complications, and long-term care strategies. So stay tuned and remember, your care and compassion truly makes a difference. If you found this information helpful, please leave a like, subscribe, share, and hit that lovely notification bell so you never miss an update. Also, if there are any topics you'd like me to cover, let me know in the comment section below. And please feel free to leave a comment, even if it's just to say hi. And always remember, the best wealth is great health. I'll see you next episode on Carla, Valentine, Nurse 411. Until then, stay informed, stay safe, and stay healthy.